another episode of ACR On Air, the official podcast of the American College of Rheumatology. I'm your host, Dr. John Hausman. Show notes for this episode can be found at acronair.org. You can also find our previous episodes on Apple Podcast, Spotify, and on your favorite podcast app. The State of the Art Clinical Symposium, or SOTA, is one of ACR's best meetings. Held in April every year, it provides high yield topics that you can readily apply to patients when you return to clinic. On the Friday prior to the weekend meeting, there's a whole day dedicated to fellows in training, with topics relevant to clinical care, career choices, and the practice of rheumatology. To discuss this year's SOTA meeting, we've invited Dr. Sobia Hassan, the chair of the SOTA Meeting Planning Committee, and Dr. Ibtisam Gad, the chair of the Fellows in Training Subcommittee. Dr. Sobia Hassan is associate professor in the Department of Internal Medicine at Rush University Medical College in Chicago. She graduated from the University of Nottingham and completed residencies in the UK and at St. Luke's Roosevelt Hospital in New York. She completed her rheumatology fellowship at Case Western Reserve University Metro Health Medical Center in Cleveland. She's currently the chair of the State of the Art Meeting Planning Committee. Dr. Ibtisam Gad completed her baccalaureate and MD accelerated program at the University of Toledo and the University of Toledo College of Medicine. She did her internal medicine training at the University Hospitals and Case Western, and she pursued a fellowship in adult rheumatology at Henry Ford Health in Detroit. She's the chair of the Fellows in Training Subcommittee. You'll first hear my discussion with Dr. Hassan about the weekend event for everyone, and then you'll hear my discussion with Dr. Gad about the Fellows in Training session. Enjoy. Sobia, welcome to the show.
Thanks. Thanks for having me on to talk to you about SOTA.
Yeah, so the State of the Art Clinical Symposium is certainly one of my favorite meetings that the ACR holds. I feel it's something that actually take back to the clinic when I'm seeing patients, and it has a lot of very high yield topics. So when organizing this year's SOTA meeting, what were some of the primary goals of the symposium? Were there any themes that you wanted to spotlight during the meeting?
Yes, well, I think you're right. This is really a meeting that is high yield for our attendees, and we want to cover a really wide variety of topics that are relevant to their practices, and also include expert speakers from across the country, from rheumatologists to non-rheumatologists as well. And so, really, with the sessions, we want to develop to deliver things that are very practical and can be applied to the attendees' everyday clinical practice. So, our goals are always to try to include state of the art topics, cutting edge tech treatments, technologies, but also to cover treatments that we know well and give updates about those diseases, those treatments, and highlight really challenging cases, even in things that we're familiar with dealing with every day.
And how did you go about choosing the topics and finding the speakers? Was it just you, or did you have a committee to help with that?
Yeah, we have a committee of volunteers that includes about five or six other rheumatologists. We have colleagues from private practice, from academics, and we have a fellow representative on our committee as well. And we work with the ACR staff. And so when we're trying to come up with our schedule, we look at feedback from previous SOTA committees, SOTA meetings, and seeing what the attendees liked about our meeting, what they wanted to hear about in the future. Obviously, we try not to repeat topics we just recently covered. We try to keep it kind of fresh, exciting, and new things. We pay attention to recent guidelines that may have been published, or again, cutting edge treatments and therapies.
And when thinking about organizing SOTA, how do you distinguish it from Convergence, which is, our big meeting? How do you think about which topics may belong better in SOTA than, for instance, at Convergence?
Yeah, I think the SOTA audience, although it is again varied, but we have a lot of people in private practice as well as academics. We have a lot of fellows attending our meeting, so we like to keep our topics very clinical,
Mm-hmm.
and again things that really are high yield and can be easily put into practice. Um, SOTA is a kind of nicely compact meeting. It's not as intimidating or as big as Convergence. And so we try to keep our kind of learning in a relaxed and friendly environment.
Yeah, and for the most part, there's no competing meetings, right? So
Yeah.
everybody attends all of the sessions instead of thinking, are you going to go to the RA session or the lupus session or the Sjogren's session? This is so much better that sort of everybody's in the same group, attending most of the cases together. Tell me a little bit. As let's speak about some of the highlights of the meeting. Are the first talk on Saturday is about CAR T cells and their use in rheumatology. Uh, Tell me a little bit about that topic and who the speaker is.
Yeah, so CAR T cell therapy is big in the practice of hematology and hematology malignancy, but it's going to have a role in the future of rheumatic diseases such as lupus. And so I think rheumatologists, we're less familiar with CAR T cell therapy. So what we are going to do is we've invited Dr. Javier Munoz, who's an expert in CAR T cell therapy from the Mayo Clinic, to come to talk to us about what CAR T cell therapy exactly is, but also how he sees that might be used in the world of rheumatology in the future. We also actually have another kind of cutting edge talk. Dr. Lou Bridges from HSS will be talking to us about the role of artificial intelligence in the future treatment of rheumatoid arthritis. So those are some of the topics that I think are kind of cutting edge.
Yeah, it's so cool to see both of those topics included there. So not only, do you have sort of very clinical topics that people can use, but you also introduce a little bit about things that are up and coming, such as CAR T and artificial intelligence. Um, and it's interesting, as I was looking at the speakers. I mean, you have like really like world famous and expert speakers in so many of these topics, which was incredible to see all of them put together, coming together to lead this meeting. And actually, in fact, many of them that we've invited here to speak at ACR on air, which is great. So, for instance, like Ann Bass talking about vaccination guidelines.
Yeah, absolutely. We're very lucky to have, great speakers, all experts in their field, and they've been very supportive of SOTA throughout the years, and where, they continue to help us out with our sessions, and we're very grateful to them. So, yeah, we've included some of the latest guidelines. So, vaccinations with Dr. Ann Bass is going to be one of those. And we also have a session on the recent ACR guidelines on integrative treatment of rheumatoid arthritis.
Mm.
And you mentioned some of our other experts. We are going to have a talk on Vexer syndrome. So we're going to cover those complicated, confusing diseases that I think we all struggle with. And for me, personally, Behçet's is one of those. And
Mm.
Dr. Yaziki is going to be talking to us about that disease. But as I mentioned, we're also going to just cover the topics that we know well, like rheumatoid arthritis, Sjogren's, but we're going to focus on the challenging aspects of those
Aha.
diseases. Um, and so a lot of our sessions are going to be called challenging cases. And I think those are always very useful.
I totally agree. I think it's so sometimes it's really hard, sort of learning about the guidelines or learning about the evidence and figuring out how to apply it to your patient and having cases presented where an expert, sort of thinks about and sort of juggles the options about diagnosis or treatment, in front of the audience can be really powerful learning tool. I love presentations that have a lot of cases like that you're including. And you're talking about one of my favorite topics, fibromyalgia and chronic pain. I feel like it, we all encounter these patients, and it's so challenging for us to know what to do with them. Certainly, uh, sometimes I feel like they're more difficult than to treat than a vasculitis patients, because we know that we should give them rituximab or something like that, whereas the
Yeah.
fibromyalgia cases are sometimes more complex. So it's great that you're including that.
Yeah, absolutely. When coming up with the agenda, again, we're trying to think about things that the rheumatologists are seeing in the clinic that they may be struggling with, and so we kept it as broad as possible and as useful as possible. I also wanted to highlight that some of the speakers that we've invited are non-rheumatologists, and I
Uh-huh.
think it's always valuable to hear the insights from our colleagues in other specialties because they kind of provide a unique perspective on the diseases we see. So this year, for example, we're going to hear about cardiac sarcoidosis
Mm.
from a cardiologist from Vanderbilt, Dr. Petrotti. And then we're also going to hear about neurosarcoidosis from Dr. Tavi, who's a neurologist at National Jewish Health. So again, we're going to have both rheumatologists, non-rheumatologists, and get a lot of perspectives on the diseases that we see.
I love it. And there's going to be on Saturday something called Cocktail and Cases. What is that?
Yeah, so we're really excited about this. This is a great networking opportunity at the end of our Saturday session. And it's going to be a great opportunity to interact with our expert speakers in a kind of relaxed atmosphere with food and drinks available. But it gives you a chance to ask them questions about cases that you might have had personally that have been challenging to you. And also, it gives you an opportunity to just maybe even ask them about some career advice or professional development. So, again, this is an opportunity that we really highly recommend our attendees join.
Yeah, and I think one of the great things, or the greatest thing about all of these ACR meetings, is the ability to network and meet with colleagues. And it's so great that you've sort of built that aspect into the schedule for the meeting. Couple other things I saw that were interesting for Saturday's hypermobility syndrome, and often those patients sort of fall in the chronic pain space. So it's amazing that's going to be uh, included there, and similarly, complications from checkpoint inhibitors, which are something that at least in my clinic, where we're certainly seeing more of, over the past couple of years.
Yeah, absolutely. So again, Anne Bass is going to talk to us about the checkpoint inhibitor complications and give us some updates because we've been seeing these for a few years now, but still, I think, find them challenging. And then for me personally, even hypermobility syndromes get really confusing with the terminology. And so Dr. Anne-Marie Malfay from Rush University is going to help us try to understand the categories of hypermobility syndrome and how to recognize them.
Fantastic. Such an important topic. And actually, we haven't had people talk about hypermobility syndrome within for our podcast. So maybe that's a good, good, good topic to bring forth in the future. And then we turn to Saturday. So you mentioned that you'll start out with Marcia Ferrata talking about Vexus. Another previous guest on our podcast, and then lung disease and scleroderma. Such a you know important topic. Um, and you have Dinesh Khanna talking uh, about that.
Yeah, absolutely. Again, we're fortunate to have some real leading experts in their field talking about those diseases. VEXA syndrome, I like the title and I think it's really relevant. Still vexing the rheumatologist, still something really tricky to identify, but just to hear some polls about how to recognize that disease, maybe some updates on how we actually do the genetic testing would be really useful for the rheumatologist. And then lung disease and scleroderma, again, a great topic. And we've paired that with things like digital ischemia for the rheumatologist.
Oh, amazing.
So we're going to cover some of the important aspects of scleroderma um, in the morning, and then finish up with the sarcoidosis cases on Sunday.
Great. The cardiac and neurosarcoid that you mentioned. Uh, Fantastic. And in between there, Lou Bridges talking about artificial intelligence for the future of rheumatoid arthritis management. What a cool schedule. Tell me, when trying to design the schedule, did you come up with any specific challenges in figuring out how to put all of this together?
Yeah, well, the challenges are always to try to keep our topics original. Again, we don't want to repeat topics that we've done the last few years. Um, we try to get new speakers if possible. Again, we've got a lot of leading experts, but we do try to also invite maybe people who are up and coming
Mm.
and coming from diverse places across the country. Um, we had the challenge of wanting to truncate our Sunday schedule a little bit just to make it easier for our attendees to be able to travel back to wherever their home cities are. So that's why, compared to previous years, our Sunday agenda is slightly shorter. But again, we hope this encourages more people to be able to attend SOTA, knowing that they are able to leave at a good time on Sunday and get back to work on Monday. But the challenges, yeah, those are really other challenges.
Hmm. And tell me a little bit about the details. So what are the dates and location?
Yeah, so SOTA is going to take place April 13th and 14th in Chicago. So we're back in Chicago after a few years of being in Orlando. And the venue is the Fairmont Hotel, which is in downtown Chicago. And, obviously I'm biased because I live and work in Chicago, but it really is a great city, one of the best cities, in my opinion, in the US. So for anyone who's never been to Chicago, this is a great opportunity to not only attend the conference, but spend time visiting the city. We've got an amazing food scene, great museums, and a beautiful lakeshore trail. Um, and if I can suggest something for people who've never been to Chicago, who have never done it, I mean, I think going on an architectural boat tour is a must. It's like really one of the highlights of seeing Chicago.
I love it, and I've done all of those, and I can vouch for each one of them. How amazing Chicago is, and I always have a great time when I attend SOTA. So I think I'm sold. So for people interested, where can they go to sign up? And another question: is this going to be available to attend virtually, or is it an in-person meeting?
So this year it's going to be in person only, but we encourage you to sign up. You're going to go to the ACR website and you'll see a link for SOTA registration. And there you can review all the agenda in greater detail and sign up.
Fantastic. So we'll have a link to that in our show notes. And then just one more thing. You mentioned that this was a committee of volunteers. So if people are interested in helping to design, curricula, for instance, for SOTA, for convergence, or getting involved with the ACR, what sort of opportunities are there, and how can they get involved?
Yeah, there's actually a lot of volunteering opportunities for a lot of different committees at the ACR. I can speak to being a committee member of SOTA, and then I was also a member of the Committee of Education. But we have committees also on the annual conference planning meeting. Um, but it really is a great way to meet people. You get to meet a lot of the ACR staff, you meet fellow volunteers, and it really gives you a valuable behind the scenes look at how the ACR runs. And it's a satisfying way of serving our community. And it looks good on the CV. To be honest, it definitely helps with professional development. So if that's something that you're also looking for, I would encourage everybody to try to find one of these opportunities to being a volunteer for the ACR.
Absolutely, I can second that. I've been involved with the ACR now for a few years, and it's given me back so much more than I give to the ACR. It's been a wonderful experience. Sobia, thank you so much for talking to us about SOTA, and I look forward to seeing people in Chicago in April. Thanks so
Yeah.
much.
Thank you so much for giving me the opportunity today.
Ibtisam, welcome to the show.
Thank you. Thank you so much for having me.
So, in thinking about the fellows in training session for SOTA, what were some of the goals? What did you try to achieve when organizing the curriculum?
Yeah, so first of all, the organizers were a group of fellows, and we're all from different places around the nation. We have the planning committee, the fit subcommittee includes first and second year fellows. So as a group, we all have different backgrounds and different things that we really want to bring to the table. And something this year that was really important for us is to try to make some sessions that were interactive. There's classically there's a lot of like lecture style talks in the fit programming, which we are still doing, and we have some oldies but goodies that we're doing again for sure, like the career panel. Um, and the physical exam workshop, but we're bringing a couple new ideas. One of which we did last year, like the great debates, and we're doing a kind of unique networking event at the end to really try to make things interactive, so that fellows, when they come, they can meet other fellows, have that, one-on-one conversations and group activities. So that's something we really were trying to accomplish with this year's agenda.
Yeah, I feel like in the past when I've attended the fit session at SOTA when I was a fellow, it was certainly the highlight of my conferences because it's you like you mentioned, you get to meet other fellows from other institutions, and it felt very manageable, unlike Convergence, for instance, that is like totally overwhelming.
You're absolutely right. SOTA is more intimate in that you get to meet other fellows, and the programming, it's both educational in terms of like learning your rheumatology, but then also preparing fellows for things like what's their niche or job applications. And so it's a very well-rounded conference. So I agree, it's one of my favorites, and we've definitely had a lot of positive feedback from fellows who attended last year. So we're excited about this year, very much so.
I love it. So tell me about the first session. It's something called Navigating the Maze: Overcoming Barriers to Rheumatology Medication Access. What's that session all about?
So what we wanted to do was kind of equip fellows with some common, with solutions for common issues that our patients experience. And actually, Dr. Feldman has spoken on this topic before in one of our fit. So Dr. Rashmi Detal. So Rashmi said that she heard Dr. Feldman speak before, and it was absolutely phenomenal. And she was just raving about Dr. Feldman talking about this topic. And we agree that this is such an important topic. What we're able to give our patients, what medication they're able to have, and insurance prior auths, and all these issues
Wow.
and cost of medications. This is a big issue for our patients, and it's part of our training. Calling for a peer, and we know it's going to be a big part of when we practice, so as fellows. And so we were really excited when Rashmi spoke about Dr. Feldman's excellent talk, and so we wanted all of our fellows to be able to hear about this at SOTA.
I love it. And it goes back to what you mentioned initially, that it's not just about the topics of, that you'll need to become a rheumatologist, but you also wanted to address some of the, things about career and like how to actually care for patients. And, this is one of those things that I didn't learn during my fellowship. And it's something that you're going to have to stumble through, when you become an attending. So it's
Absolutely.
so good that you're providing sort of an overview for fellows for that. Amazing. And then after that, you have a career panel. So tell me about sort of who you've invited and what career paths they're going to be highlighting.
Absolutely. So, the career panel is a oldie but a goodie, and the purpose of the career panel is to hear from attendings across the nation with different expertise, their specific path, their journey, what they recommend for fellows to do, so that we can learn from their experience. And so we've invited a few physicians. So we invited Dr. Bartels, who's a chief of rheumatology at Wisconsin, and Dr. Angus Worthing, who's come and spoken at our career panels for many years now, actually. And he's a very engaging. He is a physician at Arthritis and Rheumatism Associates, and what he is, he's in private practice, so we get that perspective. And Dr. Dinesh Khanna, who is a big scleroderma researcher, very well known name at the University of Michigan, who has his own scleroderma program and he has published great work on scleroderma. And our last speaker that we had planned was Dr. Anisha Dua at Northwestern, who is a program director, and she kind of gives us the medical education perspective in terms of careers. Although just yesterday, she told us that she's not able to make the conference, which we are very,
Ah,
very sad about. But we have somebody else on the back burner. Who we're going to hope to have, who's going to speak excellently as well on the topic. So that is, still pending. So I won't announce the new name quite yet, but we're hoping for a really engaging panel so fellows kind of learn about what kind of career paths they can take.
love it. So you have academics, private practice,
Hmm.
research, and education. I love it. Um, and I think Angus was there when when I was a fellow, speaking about private practice as well. And we've invited him to our show as well, and he's amazing. Okay, and then there's lunch, which I always good to have time for lunch, and then the physical exam workshops. And can I make a confession here? I
Yeah.
remember going to my first ACR meeting as a first year fellow, and by chance I was registered for one of these physical exam workshops when they were held at Convergence, and
Hmm.
it was the first time that I got to that I figured out how where the joints are and how to examine them. And this was already what 3 or 4 months into my fellowship. I had never learned. Nobody had ever showed me how to examine the small joints of the hand, for instance, or how to do a very thorough hip exam, and it was such a valuable experience that I can't stress how important these workshops are, especially when they are led by these awesome facilitators that you have.
Yeah, I agree, and in rheumatology, the physical exam is so important. And, we come from an internal medicine residency background before most folks, do their rheumatology fellowship. And, like a joint exam isn't, something that somebody thoroughly walks you through. And so there's all these skills that all of a sudden, as rheumatology fellows, one is expected to have mastered, but, maybe we didn't get, the exact walkthrough that we really need. And so the physical exam workshop is such a big hit. And during COVID, all this was virtual, and
Mm.
I think the first year I was on the fit subcommittee. They were still worried about small group and people interaction coming up in close quarters, so we weren't really able to do the physical exam workshop. And so we're bringing back, like I said, an oldie but a goodie. But um, what we did was pick certain physical exam concepts we really wanted to focus on, and some of which we also did last year, and some of which we're freshening up for this year. The muscle strength exam, and I remember actually we did this last year, and I knew my basic muscle strength exam, but I had never really thought about testing like finger flexion, and I didn't
Mm.
think I wasn't really doing that as a fellow, and um, they showed me how, and it's nice to get the expert pearls and tricks as well for a physical exam, because you might think, oh yeah, like I know what I'm doing, but then you kind of get insight about how to do something more effectively or learn a new technique. So for the physical exam, we have fabulous physicians kind of facilitating it, and it's usually in groups of about 10 fellows. And so what that each physician will kind of give a kind of rundown about what we're learning, and then an opportunity to practice on each other and making sure we're doing the technique correctly. So we're doing muscle strength exam, and then a regional shoulder exam, the knee exam, and kind of an axial spa. So kind of, doing the a lateral flexion and shoulders test, and kind of really practicing with our tape measures here. And so all the fellows should be going through each station, and we'll have the opportunity to learn each one of these. So we're excited about
Got
it.
it. I love it. And so fellows are going to rotate through all of these 4 stations.
Yes, yes. So about, 15 minutes at each station. And so each fellow, you don't have to pick. You should be getting through all four. And
Awesome.
like I said, it's in groups of 10. And so you'll have kind of that small group interaction. Like you said, soda's it's intimate. And so you get to really be able to talk to the physicians, to meet co-fellows, even when you're doing these workshops. Like the fellow next to you could be from the East Coast, and you're from the West Coast. And so you get to chat as well, which is nice.
And I love it that everybody gets to do everything instead of, having to choose one and then feel like you're, missing out. You don't get that FOMO from attending SOTA because everybody goes to everything, which is amazing.
Yeah, I can't agree with you more, John. I don't like missing anything either, so I can agree with you there.
And then I guess for the knee exam, you want them to wear shorts.
Oh no, not necessarily. Well, everybody can wear what they're comfortable in. So, but we'll kind of work with folks and whatever they're wearing, and kind of navigate it that way. But yeah, so no shorts required.
Fair enough. And then you have something called the Great Debate, but I understand that the Great Debate is a little bit different than what is at Convergence. Can you explain a little bit more about how you guys will do that?
Yeah, so remember how in the beginning you were asking me what is one of our main goals, and we really just want as much interaction and excitement, and I'm gonna throw in fun as there as possible. The first the first year we did the Great Debate was actually last year, and it was SOTA as well, and we were trying to find a way in which we can make things interactive, make it spice it up a little bit. And this is not like the Great Debate that is usually done at Convergence. It's a little bit different. So what we do actually is we break up the fellows into small groups, and folks can just sit randomly and at a table, and we give each group a topic, and you're either pro or con of the topic. And so you'll know that day, are you pro, are you con? And then, so everybody has a topic, and they're given key resources. So we've accumulated for each topic 2 to 3 resources, which you're able to review and look at as a group. And again, we're looking at groups of about 10, and you're going to either debate pro or con. You're getting about 25 minutes to review the key articles, work together in your group. We have like worksheets for how to make your debate. So you're allowed to pencil it in on these worksheets. And all this is prep time, right? And so this is just like a very submersive, active learning opportunity. You're looking at primary literature, you're talking to other fellows about their experience. And so I'm going to actually pull up the topics here so I could kind of give you a sampler of what it typically is like. But so one of the topics, for instance, is talking about an intiturative in interstitial lung disease, for instance. And so that'll be a topic we'll be debating. So you'll get the topic, you'll get this primary literature working as a group, 25-minute about prep time. And then you have to send out 1 or 2 representatives from your group, and we're going to debate in front of the whole audience. And so the pro comes up, the con comes up, and each person gives their argument and the rebuttal. And we have, we'll specify how long folks have to give their argument, to their initial argument, and then the rebuttal. And then we actually have the audience vote who they think who won the debate. And so I will tell you, last year we did this for the first time and we really didn't know how it was going to go. There was a ton of energy and excitement in the room, and we're debating things that are important and relevant to our rheumatology practice. So, tapering biologics and rheumatoid arthritis, and getting and even if you're on the side, you were assigned to pro, but you believe in con. It's kind of exciting to try to debate things, even if it's not the position that you take. And um, it's very interactive, and it's kind of that active learning of phenomena too. So and then we go through all the topics. I think we have 6 or 7 topics planned for this SOTA conference, and you hear the debate for each one of these, and so you get to, even though you only are researching one topic, you're going to hear the debate for all of them. And then we pick a winner for each topic, and it was a hit last year, and fellows loved it, and so we're really hoping it'll be just as successful this year.
That sounds amazing, and I'm sure for people that have been on debate teams in the past, this is like bread and butter for them. That sounds really really interesting, and I wonder, if we should have something like that in convergence and make things a little bit more interactive. Amazing. And then, what are the roundtables all about?
I will get to the roundtables. I just wanted to add one more thing about the great debate, because I will say, when you said speech and people who are speech and debate, it must be bread and butter for them. I was I did speech and debate all through high school. It was one of my favorite things, and so I came, when we were thinking about this idea, that was for my background. But I also want to throw out there, if this does not seem like, oh my goodness, I don't want to talk in front of people, this is like, sounds overwhelming. I will say that, you don't have to be the one out there speaking and debating. You could just be in your small group, and you're just
Right.
interacting with other fellows and learning. So it can be as low key or high key as you like. So
I love it.
I just wanted to throw that in there. Yeah. So the roundtables are, again, another oldie but goodie, and we're having over, I think it's over 20 roundtables about lots of different varying topics, with our excellent speakers. And again, small group interactive session for this one, because we have so many roundtables. We do a specific number of rotations,
Mm.
and so you do have to pick. You will not be able to do all of them, so to speak, but you kind of pick the things that you really want to learn about. And so we have topics like US sonar. So if you're really interested in ultrasound, or then we have a lot of like clinical topics, things like challenging cases in JIA or psoriatic arthritis or chronic pain. And so if you want to really learn about a specific topic, and you can bring your own cases or specific questions you have for the speakers, and a lot of times the speakers will come with their own cases and give you pearls and tricks for the clinical ones. And then we also have, what we do is we bring our speakers who were in the career panel, and they have a roundtable. So if you just loved, hearing about um, your career as a clinician educator, as private practice, um, Dr. Worthing's actually going to be at a roundtable. And if you just want to ask more questions or just hear more from him, this is another opportunity to do that. And so we have kind of, I like to think of a well balanced list of topics. And like I said, again, I'm going to give a shout out to our FIT subcommittee. We're an amazing group, and you have to remember that all these folks, they are um, first or second year fellows, and they're planning this as a fellowship's super busy, and they're volunteering all their time. And so they're coming up with these topics, coming up with these speakers, and reaching out to them. So all of these topics are produced by our FIT subcommittee. What they think is important, and and hearing from our own fellows, at our own fellowships, or even kind of getting ideas from Med Twitter about these topics. So
Mm.
this is kind of how all this is populated. So um, yeah, so that's kind of the roundtables in a nutshell.
I love it. And then you finish off Friday night with networking. So I
Yeah.
see here that it's networking by interest. Uh, Tell me
Mhm.
about that.
Yeah, so this is actually something new we're doing at SOTA. It's a new kind of event. And typically what this is replacing is more of a didactic session. And we just really, we got a lot of feedback from our fit subcommittee and just fellows in general that, after we did the debate last year, they really wanted even more interaction and more networking. And we wanted to kind of formalize a networking event here and kind of make it fun. And Austin Wheeler, this was actually his idea on our fit subcommittee, and he is one of our main folks who helped prepare this with the rest of the FIT subcommittee members. And so, what we're going to do is kind of divide folks based on their interests. So, whether they're really looking to be in academic medicine or in private practice, clinician educator, clinician investigator, and if you're not sure, you could hop on any table. It doesn't matter. This is not You're not set in stone for life based on your decision here at SOTA, but getting folks who have common interests to just talk to each other. And we have kind of conversation starters at each table. We're planning for some refreshments as well. And we actually have some interactive games that we're going to include here too, with hopefully a raffle. So this is all things that we have planned. So really just an opportunity to talk to other fellows and hear about their experiences and what are you doing at your program, and oh, I'm learning about this. And that's how ideas are shared, and you're meeting not just new friends but new colleagues that hopefully will know for many years to come.
Amazing. And, I think it sounds like you've done an amazing job of making this interactive. As I see the schedule in the morning, there's a little bit of introduction, a little bit of didactic, but then the whole afternoon is interactive sessions on the physical exam, on the great debate, the roundtables, and networking. So, if your goal was to, make this interactive, I think you've definitely met that goal.
We hope so. And I think we're coming from after the COVID area of everything being virtual and everything being, on the camera. So I think we're craving that. So craving the interaction. And so we hope our fit subcommittee, like I said, it's a wonderful group of fellows, and they put a lot of work to plan this. And I hope everybody loves this as much as we hope you do. So.
Awesome. And for people interested, we're going to have links on how to sign up for SOTA and how to sign up for the fellows in training session that's going to be on the day before, on Friday, April 12th, starting at 10 o'clock in the morning. And I believe this is also at the Fairmont in Chicago. Is that right?
Correct. Yep. That is absolutely right. And I will throw in there as well that if you are on Med Twitter, our Fit subcommittee members are actually posting about the SOTA conference, and you can get live updates, or if you just want it. So please follow our. I'm at IGADMD, but all of our Fit subcommittees, a lot of them are also on Twitter, so you can hear more about SOTA and the hype about SOTA on there as well.
Or the platform formerly known as Twitter
X,
and
yes.
now known as X.
I apologize, and it's called X.
Oh
It was
my
my
goodness. Maybe it'll
mistake.
have a different name by the time this episode comes out. But Ibtisam, it's
Well,
been a pleasure speaking with you, and I'm very excited about this. I wish I could attend, and I hope all the fellows out there listening, will be able to attend, and I hope all program directors allow their fellows to attend this wonderful symposium that Ibtisam and the rest of the FIT subcommittee have created. Ibtisam, thank you so much for speaking with me, and good luck in Chicago.
thank you, John. Again, thank you for the invitation, and thank you for letting us talk about the fit programming. We're very excited, so thank you.
Well, there you have it. With practical tips for fellows, including discussions about career choices and the practice of rheumatology on Friday, to state of the art didactics on CAR T cell therapy and artificial intelligence, as well as advances in more bread and butter topics such as rheumatoid arthritis, CPPD, fibromyalgia. This year's SOTA meeting is scheduled to be a success. If you're interested in learning more about SOTA and registering for the event, you can go to acronair.org, and we'll have links to the ACR's SOTA pages. Thank you all for listening, downloading, subscribing to our show. and for rating us with 5 stars, or however many stars you think we deserve. You can find our show notes for this and every episode at acronair.org, as well as on Apple Podcast, Spotify, and on your favorite podcast app. Until next time, don't forget to book those tickets to Chicago, and of course, stay healthy.